Hi, I'm Dr. Bruce Chalmer. Let's talk about sex. I'm assuming you're watching this video for one of three reasons. Reason number one, your sex life is somehow unsatisfactory. Maybe it's non-existent, or you want it more than your partner does, or your partner wants it more than you do, or you both are interested but it just isn't very good, or you're having problems becoming aroused or staying aroused or otherwise performing sexually the way you wish you did. You're looking for some help to make it better. Reason number two, your sex life is basically good and you are happy with your partner, but you're curious about how it might be enhanced further as a pathway to growth and greater fulfillment, and something about that idea of sacred sex in the title caught your attention. Reason number three, it's a video talking about sex, and even though you've already figured out that this is not pornography, maybe there's something here that you'll find, well, sexy. Of course, you might be watching for some combination of those reasons or some other reason altogether, but I'm assuming it's pretty much one of those three. Sex is important to you, whether you're having problems with it or you'd like to enhance your experience of it, or you're just excited by thinking about it. Any of those are good reasons to be watching this video. So, let's talk about sex. First off, what is sex? What are we talking about? As the title of this video implies, I'm going to talk about three types: plain old sex, good sex, and sacred sex. As you'll hear, they overlap, but they aren't the same. And as far as A Course in Sex goes, this one is cumulative. To have good sex, you need to have mastered the basics of plain old sex. And to have sacred sex, you have to be well versed in good sex. The first type, plain old sex, is pretty much what you think it is. In a broad sense, plain old sex can include sex by yourself or all sorts of sexual activity with others. We're not just talking about intercourse. Most people want sex, or at least did at some point. Physiologically, we're wired to seek it out, just like we do with other appetites like hunger and thirst. It usually feels good on a basic level when that appetite is satisfied. Like other bodily activities, we experience plain old sex in a lot of different ways, as fun and relaxation, as a distraction from anxieties, or even as an addictive compulsion. And like other bodily activities, sex can happen in abusive contexts. My main focus in this video is on sex involving consenting autonomous adults, but I need to mention abusive sex because it's common and is a big factor in the problems people come to see me about. A lot of you watching this video have experienced rape, molestation, or other sexual violations, and you may be wondering if you can have, or perhaps regain, the healthy sexuality that was injured by the abuse you went through. The short answer is yes, you can, but it might take some work and therapy to help you get there. Check out my videos on healing from trauma for more about that. Even if you haven't been traumatized in some specific way, you might still feel that sex is scary or somehow wrong or dirty or shameful. There are all sorts of ways other than sexual abuse you might have absorbed those messages. From your parents, either by explicit teaching or implicit example, from your peers, from media, religious leaders, teachers, and other cultural influences, or even just by difficult experiences you've had. And those negative feelings about sex and sexual pleasure are a problem even for plain old sex, to say nothing of good sex or sacred sex. Of course, the premise of this video is that sex, even plain old sex, is a positive, healthy, potentially joyous part of living. If you don't feel that way but wish you did, therapy could help. Whether or not you get help from a therapist, there are some basic skills you need for plain old sex. So here are some questions to see what you might need to work on. First, how do you feel about giving yourself physical pleasure? Is it okay to masturbate to orgasm? If you aren't okay with giving yourself sexual pleasure, why not? Were you told it was wrong or dirty or that it would cause illness? I'm not trying to imply that you have to masturbate to be healthy. People choose to abstain from sexual activity in general, or masturbation in particular, for all sorts of reasons, including medical issues, religious or philosophical belief, or a simple lack of interest. That's not pathological. And of course, some people need to abstain from masturbating because how they use it has become problematic, perhaps as part of an addictive pattern or an obsessive compulsive ritual or as a way of avoiding intimacy with a partner. But if you're watching this video because you want to improve your sex life, and you find that the thought of masturbation causes you anxiety, you need to start by getting in touch, literally and figuratively, with your own sexuality. You'll need to learn by experience that sexual pleasure can feel good and isn't dangerous. You'll need to develop the capacity to stay emotionally present during sex and to feel what you feel, skills that are often compromised by a history of abuse. And while you're at it, you can learn more about your own body and your own sexual likes and dislikes. If you need help with these things, get yourself to a therapist who's comfortable talking about sex. Well, if you're okay with sex with yourself, how do you feel about sex with a partner? Is it okay to receive pleasure from a partner? Is it okay to give pleasure to a partner? Can you share sexual pleasure with a partner you love, or does it have to be someone you're not too bonded with? Can you see your partner as both someone you desire sexually and someone you love emotionally and spiritually? If you feel that sex is somehow dirty or shameful, or worse, that you yourself are somehow dirty or shameful, you'll have a difficult time desiring someone you also love and respect, or expecting to be loved and respected by a sexual partner. Again, talking with a therapist can help you heal from the hurt such messages may have caused you, so you can experience sex with a partner as positive and loving. Another question about sex with a partner. Do you feel able to say no, even at the risk of disappointing your partner? If you can't say no, you can't really say yes. If you're in an abusive relationship, you need to get out and get safe. But even if your partner isn't abusive, you might find that you're afraid to say no because you've come to believe that giving yourself sexually is the only way you'll be lovable. This is often another consequence of a history of sexual abuse, or just harmful messages from earlier in your life. And if you're afraid to say no because you don't ever want to hurt or disappoint your partner, regardless of your own feelings or preferences, you're essentially shutting off part of who you are, which is the opposite of intimacy. You can have sex that way, but not good sex or sacred sex. Again, if that's you, get yourself to a therapist and work on learning to say no when you need to. And one more thing about plain old sex. To have sex with a partner, for that matter, even to have sex with yourself, you also need to have some basic understanding of anatomy, what's where, and physiology, what does what. You'd be amazed, or maybe you wouldn't, at how many otherwise well-educated people have little knowledge of how their own body works, to say nothing of how their partner's body works. So some basic sex education might also be helpful. Okay, so you view sex positively, are comfortable with your own body, and have a pretty good idea of how everything works and what feels good. Congratulations! You're ready to move from plain old sex to good sex. And that's where we'll start in part 2 of this video.